Good evening. Welcome to Wednesday Night Study Live here on Tisha Talks Mental Wellness. Welcome. Come on in. On Wednesday nights, we gather live to study for addiction counselor exams. Happy to be back, guys. Come on in. If you're new here, I'm Letitia, a licensed professional counselor and licensed substance abuse treatment practitioner. I provide mental health and substance use education and trainings. And over here on this side of YouTube, we study for addiction counselor exams. So if you're studying for any addiction counselor exam, you can be in a counselor program. You can be studying for the NCAC 1, the NCAC 2, the MAC exam, the ADC, the AADC, the CADP, I think, certifications all over the country nationally. We meet up and we master foundational topics. So, our frequently asked question is this good for dot dot dot? Yes, it is, because we are all studying and mastering topics. However, for your specific exam format, you need to go to your exam website. And finally, since you have asked for the past few months, I've designated a few hours on Friday, Saturday, and Sundays Eastern Time for one-on-one exam coaching. So in the description below and also in the chat, I have free resources, other study resources, and I've added one-to-one exam coaching. This is for someone who is obviously preparing for a license or certification. You need help with strategy or you need help with a specific topic. We take an hour and we get to it. You pick two topics and we study, we do practice questions, we come up with a specific strategy. That's where you can do a specific strategy. But other than that, I'm happy that you're here. When you come in, please like the video. Please make sure you're subscribed so you never miss a study video. And put a 1 in the chat if you can hear me clearly. Good evening, One Nene Bread. Good evening, Sherry. Good evening, Malik. Great. I'm happy you guys can hear me. Let's go ahead and get started, y'all. Again, this is Addiction Counselor Exam Prep live study group where we gather to answer 10 practice questions. I read the question, pause, you put your answer in the chat, then I read the answer with explanations. This will help us with preparing for addiction counselor exams, but also with our clinical reasoning and mastering foundational topics. We'll complete the 10 questions, and at the end, you can have Q&A time. And that's where you can ask me anything addiction counselor related in terms of licensure, certification, questions, topics. We fill our entire hour, and the hour goes by pretty fast too. Tonight, our topic is screening for risk of harm. So a couple times a week, I do my own studying just so I can stay crisp and I'm up on top of the knowledge. So I'm able to make these videos and come live. So we're all studying together. That's why we're study partners. I'm not the teacher. I'm your partner. I'm your colleague. And I came across an outline where it was about screening for risk of harm and the skills that you needed in order to screen a client successfully to keep them safe. So tonight, all of our questions are going to be related to screening. The questions are going to be related to indicating a threat or serious harm, identifying a crisis, identifying risk and protective factors, can you identify a medical complication? And because we are addiction counselor professionals, that can involve withdrawal, overdose, medication, toxicity, knowing the signs and what to do. If you are on my email list, you got this little infograph or photo. If you're interested in joining my email list, just go to my Stand Store link, which is in the description, and download the free outline, the free study guide. And that automatically puts you on my email list. I send reminders, and that's a way for us to remain connected in case all this social media stuff goes away. We'll still have each other's email so we can continue to study together. Let me check the chat. I got to get better at checking the chat once we get started, y'all. Okay, anybody else come in yet? Good evening, good evening, good evening. And hello to the playback. If you're here and you can make the live, no worries. You still have to do your practice questions. Make sure you put in the comment, say hi if you're already a study partner. But if you're new, put the state you're in and then put what addiction counselor exam you're preparing for. Or you can put why you are in the study community. Some people just like to learn. Some people are in college. Some people are not addiction professionals, but they are studying for their counseling certifications. And some of us are active working therapists. We have lots of clinicians in our group, guys. So most of us already have experience. So we are forever students. Good evening, Cheryl. Good evening, Sherry. Zach passed, y'all. Zach says, I passed the ADC. Thanks for your help you do here. You're welcome, Zach. And thank you so much for updating us. And we appreciate you for supporting this community. Everyone congratulate Zach before we get started. Zach passed the ADC. We also had another study partner last week to pass the AADC. She earned her LADC. So again, everybody's studying for a different exam, but we're all gathering for the same reason. So come on in. Come on in. I see some people studying for the NCAC 1. New York is in the house. Virginia Beach is in the house. My hometown. Well, 757 Hampton Roads. All right, y'all. I am so happy you guys are here. Let's go ahead and get started. One moment. Get my camera right, guys. Trying to get the okay, here we go. All right, we are all set. All right, what to know for addiction counselor exams for our topic tonight. So the main priority for licensure and certification is safety and ability. So they're testing our ability to keep our clients safe in order to provide these specialized interventions. I'm sure everyone knows this, but we are considered a specialty under mental health, counseling, therapy. Addiction counseling, substance use counseling is a specialty. So the whole point is to be able to choose the answer to keep our clients safe. So again, when you're taking your test, don't overthink it. We are testing from the point of view of a perfect world. Many of us are seasoned clinicians. We've been in the field 5, 10, 15, 20 years. And we know there are barriers and layers to caring for our clients. However, when we're testing for these exams and certifications, they want to see our ability. They want to know that we have the correct knowledge. So don't overthink all of these scenarios. Just think, okay, this is the perfect world that everyone has insurance. Nothing is going to get in the way. They need specific help for substance use and addiction issues. And just don't overthink it and choose the answer that is the safest, most effective, and ethically appropriate for the client. All right. You need to recognize medical complications like withdrawal, overdose, medication. Don't forget to consider stressors. Also, our role is to complete a crisis assessment in the event that the client is at risk. So, tonight's topic is all about crisis screening for risk and knowing what to do. So, no matter what addiction exam you're studying for, they're testing your knowledge to be able to identify situations where the client might be at risk, and you need to know the appropriate action to take. So, assessing, identifying the risk factors, recognizing medical emergencies, intervening and referring the client to appropriate care, and documenting and following up. Okay, I'm going to check the chat and then we'll get on with question 1. All right, Cicely is here from Tennessee. Marceline is here from Indiana. Hello, Malik. All right. And before we get started with the questions, if you guys could put a 1 in the chat if you can hear me clearly. Am I crisp? I'm not lagging. Just put a 1 in the chat for me and I'll go ahead and get started with the questions. Awesome. Question 1. A counselor is conducting a screening with a client who states, "Sometimes I think everyone would be better off without me." The client reports having access to a firearm but denies having a specific plan to harm themselves. What should the counselor do first? A. Develop a treatment plan to address the client's depression. B. Complete a comprehensive assessment before addressing the statement. C. Conduct a self-harm risk assessment to determine the presence of intent, plan, means, and level of risk. D. Encourage the client to discuss these feelings during the next counseling session. What should the counselor do first? And FYI, self-harm and suicide risk are different, but you'll see me say self-harm so that we don't get cut off. Some language YouTube just flags. All right, what should the counselor do first? You're screening a client. He makes this statement, reports having a firearm, no plan. The correct answer is C. Conduct a risk assessment to determine the presence of intent, plan, means, and level of risk. The client has expressed passive self-harm thoughts and has access to a firearm, both of which are indicators of potential harm to self. Before treatment planning, routine counseling, or completing the remainder of the assessment, the counselor must determine the client's level of risk by assessing the client's thoughts, intent, plan, and access. Client safety is always the first priority. A is incorrect because developing a treatment plan is not the first step. Treatment planning is important, but it should only occur after the counselor has determined the client is not in immediate danger. B is incorrect because a comprehensive assessment is important and valuable, but warning signs of self-harm are present. The counselor should pause the routine assessment and immediately evaluate the client's level of risk. And D is incorrect because waiting until a future session delays assessment of a potentially life-threatening situation. So our job is to screen, assess, support the client on where they're at the moment. Okay. And I'm going to start adding with the explanation a section about what the exam is asking you to do, because it's going to help you connect the dots with all of this information that you're taking in. So, this type of question is testing your ability to recognize indicators of self harm in the client's level of danger or risk assessment. When you're taking an addiction counselor exam, the exam is asking you, how will you prioritize the client's safety? Okay. Question 2. A client arrives for an assessment reporting heavy alcohol use for the past several years. During the interview, the client states they stopped drinking 24 hours ago and is now experiencing shaking, sweating, nausea, anxiety, and seeing shadows that others do not see. The client also reports living alone with little family support. Which factor should be the counselor's highest priority? A, the client's limited social support, the client's possible alcohol withdrawal symptoms, C, the client's unemployment and financial stress, or D, the client's feelings of loneliness. Which is your most important priority, the highest priority? The correct answer is B, the client's possible alcohol withdrawal symptoms. The client is showing signs of alcohol withdrawal, including tremors, sweating, anxiety, and possible hallucinations. Alcohol withdrawal can become life threatening and may progress to seizures if not treated. The counselor's first priority is recognizing the potential medical emergency and ensuring the client receives an immediate medical evaluation. So, safety first. If the client has a medical emergency, we get them the appropriate help, whether it's call 911, take them to the hospital. If it's in a clinical or hospital setting, take them to medical professionals. A is incorrect because a limited support system is an important environmental stressor that may affect the client's recovery. However, it's not the most immediate concern. C is incorrect because the client's unemployment and financial stress may increase their risk of relapse, but it does not take priority over acute medical complications. And D is incorrect because loneliness is a significant emotional stressor, but it's not the highest priority in this scenario. So if you got a question like this, the exam is asking you to identify medical emergencies related to substance use and mental health issues. You also need to understand environmental and cultural stressors and where they fall in your choice of intervention. So, as the addiction professional, they're testing whether you understand some of these layered issues that our clients have and what order do you put them in? How do you prioritize how you're going to help the client? So, if a client is in active withdrawal, that's probably not going to be the moment to start therapy or start assessing. You're going to get them the medical support and stabilize first. So, that's what the exam wants you to show them. So the skills you need for this question is how to gather relevant clinical information, recognizing high-risk medical complications, determining the presence of an emergency, and how to link a client to appropriate medical resources. Question 3. A client arrives for an outpatient counseling session appearing confused and difficult to arouse. The client has slurred speech, slow breathing, pinpoint pupils, and reports taking prescribed pain medication earlier that day, but cannot remember the amount taken. What should the counselor do first? A. Contact emergency medical services immediately. B. Contact the prescribing provider to discuss the client's medication use. C. continue assessing the client's substance use history and current symptoms, or D, assist the client in scheduling a medication management appointment. What should the client do first? Okay, I see some A's. All right. Oh, let me fix the screen for you guys. No problem, Doreen. Catch the playback. Have a safe night. I'm sorry, guys. My screen it's not formatted. Let me get it right for you guys. I'm not sure why. What changed? I haven't changed anything. Let's see. I might have to size it down. Ooh, is that better, guys? Y'all let me know. Uh-oh, I'm learning. Okay. Does this make me like a tech whiz that I was able to adjust my screen? All right. Let me know in the chat if that's better, you guys. I've adjusted the screen. I guess it was too big at first. Did I change it? The correct answer is A, contact medical emergency services immediately. The client is showing classic signs of possible opioid overdose, including respiratory depression, pinpoint pupils, confusion, and decreased responsiveness. These symptoms represent a potentially life threatening medical emergency. B is incorrect because the prescribing provider should be informed as part of ongoing care, but this does not address the client's immediate emergency. C is incorrect because continuing to assess the client's substance use history would not be the appropriate intervention for a client who is showing signs of a potentially fatal overdose. And D is incorrect because medication management may be appropriate after the client is medically stable. So, a question like this on your exam is testing your ability to recognize signs and symptoms of possible overdose, signs and symptoms of a high risk medical complication, and how to make the most appropriate and immediate response. So you should be able to distinguish between situations that require routine clinical follow-up and situations that require emergency medical intervention. So this is where your clinical reasoning comes in, your foundational knowledge. So sometimes you might hear me say, oh, these are foundational knowledge questions. Sometimes seasoned clinicians will say, oh, these questions are super easy, but we still need to stay like up on our foundational knowledge because they'll layer these skills. So in this question, you need to know signs and symptoms of opioid withdrawal or opioid intoxication. That should stand out to you. So the knowledge being tested on this question is signs and symptoms of withdrawal, um, medication effects or substance use effects, signs of a drug overdose, and appropriate emergency responses. All right, question 4. Which of the following is the primary goal of a crisis assessment? A, to determine whether the client meets diagnostic criteria for a mental health disorder. To identify the client's immediate level of risk and determine the appropriate intervention. To develop long-term treatment goals that address the client's presenting concerns, or D, to explore the client's history of substance use and previous treatment experiences. What is the main goal of a crisis assessment? Let me check y'all. See what you guys got going on. Okay, I see B. All right. See a few B's. Hold on, guys. Still looking kind of like. Okay. The correct answer is B. The primary goal of a crisis assessment is to identify the client's immediate level of risk and determine the appropriate intervention. The crisis assessment focuses on what is happening right now with the client, not long term treatment. A is incorrect because a diagnosis is an important part of the assessment process, but it's not the primary purpose of a crisis assessment. The immediate concern is determining whether the client is experiencing a crisis. C is incorrect because treatment planning occurs after the crisis has been stabilized and resolved. During a crisis, the counselor's focus is on immediate safety and stabilization rather than long term goals. And D is incorrect because a substance use history provides valuable clinical information, but it is not the priority during a crisis. A question like this on an exam is testing your understanding of the purpose of a crisis assessment and your ability to distinguish between an immediate crisis intervention from other counseling responsibilities, such as counseling skills, diagnosis, treatment planning, and other interventions. These types of questions, the knowledge you need to understand is crisis assessment strategies, crisis intervention principles, crisis management goals, and immediate safety and stabilization. Question 5. When screening a client for risk of harm, which action best demonstrates the skill of gathering relevant information using all available resources? A. Reviewing available records, conducting a clinical interview, observing the client's behavior, and obtaining collateral information when appropriate. B. Conducting a detailed clinical interview while relying on the client's self report to determine the level of risk. C. Completing standardized screening measures and documenting the client's responses before deciding what additional information is needed. Or D. Gathering information from the client first and requesting collateral information only after the risk assessment has been completed. So, which one of these answers is the most appropriate or correct way to gather relevant information using all available resources? All right, I see a B, I see a C. The correct answer is A. A thorough risk assessment requires the counselor to integrate information from multiple resources. This includes the client's self report, behavior observations, previous records, if available, screening results, and collateral information when appropriate and consistent with confidentiality requirements. Using all available resources supports more accurate clinical decision making and helps ensure client safety. Okay, so to tie in tonight's theme, we're talking about level of risk. So, when we're screening and assessing a client for level of risk, we've talked about two different types of situations where a client might need another level of care or they may need support with stabilizing a medical emergency or a crisis. So, usually during crisis, you may not have access to previous records. However, you have client self report. Um, you may have someone that's with the client there, as long as the client has given permission or signed confidentiality release forms. You have just try to use more than one source. So they're trying to see if you know how to effectively gather appropriate and accurate information so we can help the client as best as we can. The correct answer is A, because the answer reflects a comprehensive approach by incorporating multiple sources of information rather than just relying on one single method. B is incorrect because a clinical interview is important, but relying primarily on the self report may result in an incomplete screening or assessment. Effective addiction professionals combine the self report with observations, records, screening tools, and collateral information. C is incorrect because standardized screening tools are valuable but should not replace your clinical judgment or additional information gathering. A risk assessment requires integrating multiple sources of information. So you get the. And D is incorrect because the client's perspective, again, is important, but waiting to after the risk assessment to obtain collateral information may delay access to critical information. A question like this, the exam is asking or testing your ability to identify the most comprehensive approach to information gathering. That's a counseling skill. How to appropriately gather information so we can help the client as best as we can. And also so we can report the information to the care team. What you need to know: sources of information during a risk assessment, appropriate use of collateral information, clinical interviewing and observation skills, and comprehensive assessment practices. Question 6. Which of the following client presentations most clearly indicates that an emergency or crisis situation exists? A. A client reports increased alcohol use, feelings of hopelessness, and difficulty sleeping following a recent divorce. B. A client reports hearing voices commanding them to harm themselves, has access to a firearm, and states they can't promise they will remain safe. C. A client reports daily panic attacks, frequent cravings, and fear of relapsing after losing their job. Or D. A client reports worsening depression, social isolation, and discontinuing prescribed psychiatric medication 2 weeks ago. Which most clearly indicates an emergency or crisis situation exists? And remember, we're in a perfect world. This is textbook. Which one most clearly indicates? All right, I see B. See some B's. Anybody have another answer? Or everyone is in agreement with B? I used this question in a supervision, and one of the interns and one of the supervisions said, "Well, what have you?" I was working with someone, and when they go quiet, that's when I get most concerned. And I was like, remember, in a perfect world, just don't think of all the experience you have and um, this one client that you used to work with or this particular population that you work with. Um, think of it as just like purely nothing is in the way. It's just the most cliche, for lack of a better word. Because if you overthink it, we can think of a million scenarios where all of these would indicate a crisis is about to exist, especially if you know the client, you know how their baseline behaviors are. But um, just think about black or white, cut and dry, perfect world. All right, because I I am an overthinker too. Because when I look at questions, I'm like, well, if the client's insurance isn't approved, and I'm like, those of us who work in the field understand there are many barriers, but just a reminder, don't overthink it, guys. You have the knowledge, you have the ability and the knowledge. Just answer the question. All right. The correct answer is B. The client is experiencing hallucinations, auditory hallucinations, that's telling them to harm themselves or someone else. This indicates an immediate risk of harm and require emergency intervention. A is incorrect because these are significant warning signs and they may require further assessment. However, imminent danger is not here for this situation, this scenario. C is incorrect because the client is having emotional distress and may be at risk for relapse, but no evidence that immediate intervention needs to be, um, they're not in immediate danger to themselves or someone else. And D is incorrect because these factors increase the client's overall level of risk and might even require assessment. But based on the information provided, it's not enough to say, oh, this is an emergency. Not like B. So out of these four options, B would be one that is that closest to an emergency or crisis situation. If you get a question like this that's asking you about emergency or crisis or what you would do or how do you intervene, it's testing your ability to determine the client's presentation. So as addiction professionals, we need to have the skill to be able to identify, okay, is this an emergency? Is this a crisis? Is this just increased symptoms? And what do I do? Because you don't want to under intervene, but you don't want to over intervene either. So can you imagine every time a client is having a craving or reaches out and says, I'm having thoughts, and immediately we go, inpatient, immediately we go 911. So you don't want to overreact either because it can damage the therapeutic relationship, the trust. It also is just not appropriate. You can kind of, you know. So we need to be able to know how to intervene. What you need to know: indicators of an emergency or a crisis. Every time someone says they're having thoughts, doesn't necessarily mean they need to go to the hospital. So I'm sure most of if you're a seasoned clinician in the beginning, it's very, it can shake you up to hear someone in that level of pain and having those thoughts, but not all the time. Sometimes they're just expressing themselves and how much pain they're in. But that's why we're the professionals. That's why we assess. So you need to be able to indicate, is this client just having an increase in symptoms? Did a life circumstance increase their risk of relapse? Um, do they have a plan? So these are the things that we train and we have to have skills in, and this is what they're testing us on these exams. We need to know high risk warning signs. So all warning signs again are not equal. Some are very high risk and where we have to deem it an emergency or crisis. We need to know all about the crisis assessment and interventions and what to do, and immediate safety priorities. So, what do you choose to do first, second, last to keep the client safe? All right, question 7. Which of the following is the most appropriate de escalation technique when working with a client experiencing a behavioral health crisis? A. Maintain a calm demeanor, use non threatening communication, actively listen, and provide the client with personal space. B. Ask direct questions, explain agency policies, encourage compliance, and redirect the conversation to treatment goals. C. Set firm behavioral limits, identify consequences for unsafe behavior, encourage problem solving, and discuss discharge planning. Or D. Gather additional clinical information, complete a mental status exam, review treatment records, and update the treatment plan. Which is the most appropriate de escalation technique if your client is having a crisis or you see a crisis developing? Right? I see a flood of A's. The correct answer is A. Effective de escalation focuses on reducing emotional intensity while also keeping the client safe. Remaining calm, speaking in a respectful and non threatening manner, actively listening, and maintaining appropriate personal space. For me, the way I remember is when we are in therapy, open ended questions. During a crisis, close ended questions. Because if they are having heightened emotions and they're escalating, you don't want to ask them open ended questions because they're already overloaded, overstimulated, approaching a crisis. Do you think just having to answer a question that requires a lot of, cognitive ability is probably not going to be your best bet in that moment? The safest. It's not the safest. So that's just how I remember it. Close end question. B is incorrect because explaining expectations and gathering information may be appropriate later, but focusing on policies and treatment goals does not effectively de-escalate a client. C is incorrect because setting limits is necessary for safety if the safety is if there's an immediate threat. But discussing consequences in discharge planning can increase defensiveness. And D is incorrect because clinical history and mental status exam are important components of ongoing assessment, but they should occur after the client's emotional state has stabilized. So, the reason why I always circle back to de escalation, crisis, and emergency, because we work in a high emotion specialty. So think about it. If someone has they're struggling with coping, they have a history of trauma, depending on how long they have been using the cope, this is something that makes them feel better. Yes, it's harming them, but when you tell somebody you're taking away their favorite thing that's making them feel better, or you talk about recovery, this can be very triggering. So we're probably constantly de-escalating, whether it's in our tone, in the verbiage we use, our body language, how we approach certain topics. We are constantly in de-escalation mode, whether you know it or not. So we are constantly trying to prevent a crisis, address a crisis, reflect on a crisis. That's just the nature of the work we do. So if you get a question related to de-escalation techniques, they are asking your ability to identify the most effective way so you can keep the client safe. So again, it goes right back to safety. If you see a client escalating, let's say you're in the middle of an assessment and you ask about trauma, and you see the body language, you see the voice raising, you see whatever you feel is escalating behavior, you have to immediately know how to stabilize and de-escalate, whether it's come back to the question later, have them take a break, talk them through it. They want to know if you know how to support a client in the moments where they are dysregulated. And that's basic safety. Again, that wouldn't be the time to continue to ask questions or to encourage further dysregulation. So as addiction professionals, we're expected to recognize these interventions so we can help calm the client before moving on to other interventions. So you will need to know how to de-escalate. So de-escalation techniques, crisis intervention strategies, therapeutic communication, and safety and stabilization principles to be able to answer these types of questions effectively. Question 8. Which of the following best demonstrates the use of environmental management during a behavior health crisis? A. Conduct a brief mental status examination, assess the client's insight, monitor mood changes, and continue the clinical interview. B. Encourage the client to identify triggers, discuss recent stressors, explore coping strategies, and develop a treatment goal. C. Obtain collateral information, review available records, consult with the treatment team, and document the client's presentation. Or D. Reduce physical stimuli, remove potential hazards, maintain a clear exit, and position staff to promote safety. Which one demonstrates environmental management? All right, let's look in the chat. I see C. Is that an A or was that from the previous? I see C. I see B. Which one best demonstrates the use of environmental management? My apologies, y'all. I have my retainers in tonight, and y'all know I will flub up a word. So which one describes managing the environment during a crisis? The correct answer is D. So the key word was environmental management. Environmental management focuses on making the physical environment as safe as possible during a crisis. This includes reducing noise, reducing any distractions, removing objects, moving furniture around, making sure you understand where the exit is. These actions help reduce risks before continuing with interventions. A is incorrect because a mental status exam does not address the immediate safety of the physical environment during a crisis. B is incorrect because exploring triggers and coping strategies is appropriate after you have stabilized the crisis. Focus on stabilization and de-escalation. C is incorrect because clinical activities that support decision making is important, but they do not reduce environmental risk. So environmental risk is just how do you make the physical environment as safe as possible. A question like this is testing your ability to understand how to make the actual environment safe during a crisis. So you need to know that some interventions need you to change the physical environment to reduce the client's risk and promote their safety. For a question like this, you need to know environmental management strategies, which will go under de-escalation techniques, crisis intervention techniques, safety and risk reduction, and physical environment modifications. Question 9. Which of the following documentation entries best reflects the required elements of a crisis situation? A. Document the client's statements, complete a mental status examination, summarize the session, and schedule a follow-up appointment. B. Document the presenting problem, assess the client's level of risk, record the interventions provided, and identify treatment goals. C. Document the client's behavior, describe the crisis intervention, record the referrals that were made, and update the treatment plan. Or D. Document the client's statements and behaviors, assessment findings, interventions provided, consultations and referrals, the client's response, and the follow-up or safety plan. One of my supervisors says all of these seem correct. I don't know. But which one best reflects the required elements? So which one is like the most comprehensive way to document a crisis or an emergency situation after it's stabilized? Okay, let's see what you guys come up with. Which is the best? I see a D. I see a C. Okay, Doreen says she changed hers. Okay. I see a A. I see 2 D's. Okay, look at it. Look at it. Which entry is the best? Okay, because I'm looking at it. Yeah, everything looks like it's pretty close, but one is the best. One of them is the most comprehensive documentation. The correct answer is D. Crisis documentation should provide a complete record of the event, including client statements and behaviors, assessment findings, interventions, consultations or referrals, the client's response, and follow-up and safety plan. A is incorrect because it does not include interventions provided or safety plan. So that's the standout. Anytime you have a crisis or emergency situation, after you've made sure the client is safe in the moment, there should be some type of debriefing, follow-up, where a safety plan is either updated or reviewed. Maybe they already had a safety plan and it worked, but it should be mentioned. B is incorrect because risk assessment and interventions are important components of crisis documentation. This option does not have the client's response. Referrals or doesn't have the client's response, referrals or consultations, or follow-up plan or safety plan. Let me look at B again. Document the presenting problem, assess it. Okay, yeah, they left out a lot. C is incorrect because this option includes several key documentation elements, but does not document the assessment findings or the client's response to the interventions. That's very important. Just fun fact, if you're interested, if you ever get into like documentation review or development or learning about how we get paid as providers, every single insurance company has what they want in the note. In response to the intervention, you never leave that out. They want to know what's working. Even if it didn't work, they want to know the client's response. But that doesn't have anything to do with the exam. That's just a fun fact that just made me, it popped up in my head. Um, but yes, D is the most comprehensive and accurate because you're documenting the client's statements, behaviors, assessment, interventions, consultations, referrals, client response, and follow-up and safety plan. This question is testing your ability to identify the ethical and legal crisis documentation. As an addiction counselor, you need to be able to recognize that documenting tells the story, because we need to be able to share how we were able to keep our client safe, how we were able to help our client get better, or what didn't work, so that, again, our team members, other care providers, and the client understands what's working, what's not working, so we can continue to support them. What you need to know: elements of crisis documentation. You need to understand clinical documentation standards. What's good, solid documentation and what falls short. Legal and ethical documentation requirements. And continued care components, like the standard to have solid continuity of care or continued care. And the last question, question 10. When evaluating the client support system during a crisis assessment, which of the following provides the most useful information for determining the client's immediate safety? Determine whether supportive individuals are available, willing, and able to assist the client during the crisis. Identify the client's family history, household composition, and previous living arrangements to better understand family dynamics. C, review the client's social activities, community involvement, and recreational interests to identify long-term recovery supports. Or D, explore the client's employment history, financial resources, and transportation needs to identify potential barriers to treatment. Which is the most useful information about the client support system? So when you're making sure you've stabilized the client, you've supported the client, which one of these is most important to make sure they have support at home when they go home? Okay. The correct answer is A. Evaluating a support system involves determining whether clients are or other people are available, willing, and capable to help the client after a crisis or even during. The counselor should assess the quality, reliability, and accessibility of the client's support system. Again, the support system won't always be the family. However, you want to make sure every single person who is identified as a safe, supportive person has to have a confidentiality, not a confidentiality agreement, a release of information. So if the client says, oh, my best friend, that's who I live with, that's who is supporting me right now, that's where I feel the safest. If you don't have a release of information, best friend, you cannot discuss the care. So again, it's not always the family, but you have to make sure there's a release of information. B is incorrect because understanding family dynamics is clinically valuable, but it does not determine whether the client has immediate, reliable support during a crisis. C is incorrect because community involvement may strengthen recovery over time, but it does not directly assess whether someone is available. And D is incorrect because these factors may affect treatment engagement and recovery planning, but they do not evaluate the client's immediate support system. All right, so when you're screening for risk of harm, these are your main knowledge area, skills area you need to know to master the ability of screening for harm. Understand how to gather information, understand how to assess risk level, understand how we communicate as mental health and addiction professionals. We need to be able to recognize emergencies. You need to understand components of de-escalation. You need to understand how to manage the environment during a crisis or an emergency. You need to understand how to link resources and refer a client. And you need to understand the documents of solid, ethical, legal documentations of an emergency or crisis. And you need to understand how to evaluate supports for the client. I'm going to stand around for a few minutes, guys, if you have questions. Sorry, I went over a little bit. I was yapping in the beginning. But thank you, guys. Let me put on my camera and look at the chat. Okay, camera's back on. All right. Now let's go to the chat. Okay, I hope this was helpful for you guys. Oh, thank you. This was good. I'm glad I was able to attend. I'm glad you were able to attend. Thank you, guys. Malik says, how do you subscribe? If you go to the page, there should be a red subscribe button in your YouTube app. Let's see. Am I on? Oh, I'm not on my right. So if you're on your phone and you click on my page, it should be a red subscribe button. Let's see. Let me look at it. Well, no, did they change something? Oh, no, it's not red. It's just, if you click on my page, there's I don't know if you guys can see it. It just says subscribe. Oh, I haven't seen it on the app. They're always changing stuff. I can't keep up. So if you are looking at the app on your phone, you click on my picture or the page, Tisha Talks Mental Wellness, and directly under the description of the channel, it says subscribe beside a little bell button. That bell button, if you select that, it'll send you an email when I post a community post, when I post new videos. So yeah, make sure you guys are subscribed. But in addition to that, if you go to the link that I have in the chat, or go to the link in the description, that's my Stand Store, download the free study guide that automatically puts you on my email list. If you got an email from me about this live tonight, you're already on my email list. So don't worry about it. But if you're new, go ahead and get your free download, your free study guide. And that means I have your email forever. So I get to update you just in case all of this social media stuff goes away. I'll still be able to contact you and we still can meet up. All right. Okay, I hope it was helpful for tonight. Again, don't forget in August, these are going to be 3-hour intensives. So we're going to have 4 3-hour intensive sessions in August. So we have one more for this month, and it'll be the regular on Wednesday. I'll start at 7 to 8. But the first week in August on Wednesdays, I'll start at 6 because I want to do some intensive so you get an idea of how long 3 hours is. So there'll be 3 different topics. It'll just be like our hourly sessions, but 3 in a row. So I hope some of you can. I want to see who's going to be able to do the whole 3 hours with me. But if not, no worries, no pressure, guys. Y'all know y'all can always catch the playback. You also can hop in on the second hour or hop in on the third hour. But I will be up here at 6, 7, 8. So from 6 to 9. And they're going to be our intensive sessions, and they'll be recorded, obviously. So again, I hope you guys are able to join me for my intensive sessions in August, starting in August. It'll just be for the month of August because in September is recovery month. So I want to make sure y'all have enough content, enough in the event if I can't meet all the weeks in September. Okay. Thank you guys. Thank you guys. Have a great evening. Malik says, thank you very much. I just completed substance abuse counselor. Congratulations. I'm learning too, guys. I'm studying the main exams because if I'm offering the one-to-one intent the one-to-one coaching, so I'm studying the ADC requirements. I'm studying the AADC requirements. I'm literally your study partner. I do not know it all. I passed the NCAC one in 2016, so I'm learning and sprucing up. I'm just having the time of my life. So thank you guys for supporting this community, for just your knowledge, your kindness, your motivation. You guys have a great evening. Cicely, so starting in August, I'm gonna stay on Wednesdays, but it's gonna be intensives in August. So I'm gonna start at 6 and I'm gonna go to 9. So from 6 to 7, we'll do 10 questions on one topic. From 7 to 8, we'll do 10 more questions on a study topic. And then from 8 to 9, we'll do another topic. And of course, we might have, a couple minutes in between if people need to get up and stretch. But it's going to be an intensive because it's going to be 3 hours in a row. And it's going to help us. Some people can't join, but they might want to come to an intensive just to get the 3 hours out the way. But also, I suggest try to join and stay to 3 hours because that's going to, for those of you who have not taken certification and license exams, most of them, they give you 3 hours. Most of the exams are between 100, 150 questions, 3 hours. Some people don't have to stay the whole 3 hours, but I think it's helpful to practice in exam settings as close as you can get. Oh, I can see myself looking all over the place. Look at me. But yeah, so not until the first week of August. So if you can, please join. But if not, just join at the regular. Just do the 6 to 7 if you can't. That's fine too. But I'll be here from 6 to 9. Initially, I wanted to do intensives when I first started the channel because I didn't see a lot of videos that went beyond an hour. I seen a couple like counselor exam prep videos that I used to look at when I was studying for my LPC exam. So I was like, oh, I want to do intensive, but that's not sustainable. So I was like, in August, I'm going to do intensives all month. That way you can just live on the channel and you can always go back to it. So Cicely, Wednesdays in August, it'll be 6 to 9. So get your water together, get your safe, quiet space together, get your snacks together. We're gonna be doing 3-hour shifts in August. All right, I'm gonna stay to 8:10 and then we're gonna get out of here. Again, thank you so much. Again, if you're new, welcome to our learning community. All you gotta do is just show up. Hello to the playback. Are y'all still with me, playback? If you're here watching the entire video, thank you. Thank you for supporting the channel. Make sure you put in the comments that you're watching the playback. Let me know what you're studying. Let me know what exam you're studying. What topic is very hard for you. I answer every single comment, y'all. So we're growing, but we're still small enough that I can check the comments and talk to you guys. All right, Malik. Okay, Malik says I'm down for August. All right, I'm ready too. All right, you guys have a good evening. And I will see you guys next Wednesday. Thank you so much for joining us. Take care.